Dr. Kalumbi Shangula says all epidemiological evidence points to a third wave, and it thus calls for everybody to do their part to suppress the spread of the virus.
As at yesterday, Namibia reported a cumulative number of 59,092 confirmed cases and 912 deaths, compared to 355 deaths reported by the 7th of February 2021. The recovery and death rates for the last epidemiological week is 89.4% and 1.6% respectively. The number of deaths has far surpassed the figure estimated in the disease estimation projection model. That indicated that Namibia would have recorded 834 deaths due to COVID-19 during the years 2020 and 2021. In the last 2 weeks, Namibia reported 5,761 new confirmed cases and 147 deaths. By any measure, these numbers are indeed alarming.
Also of concern, he says, is the presence of a South African variant in a significant number of COVID-positive cases in the country. Dr. Shangula reveals that the pandemic is taking a heavy toll on mental health, which requires psychosocial support and counseling for patients and their families. This is particularly the case after diagnosis and more especially in cases where patients succumb to the disease and families require bereavement counseling, says the minister. Also, bed occupancy rate in most COVID-19 isolation and ICUs, both in public and private sectors, range between 67 and 100%.
With the increase in the number of hospitalizations and the fact that COVID-19 is highly infectious, measures are being implemented to decongest referral hospitals by reducing the number of cold cases and elective surgical procedures to referral hospitals for the time being.
The ministry further advises families to bury their loved ones speedily to decongest mortuaries. To ensure consistent supply of oxygen, the government is improving and increasing oxygen generation in the wake of reports of hospitals running out of the life-saving gas. In this regard, it is constructing dedicated oxygen generating banks at the Windhoek Central and Onanjokwe hospitals, while the Katutura Hospital's respiratory unit and the Shakati Hospital will be provided with oxygen tanks. The ministry, he said, will also recruit additional staff to have more feet on the ground, as well as procuring more supplies and commodities, including PPEs, essential medicine, vaccines, and other essential items.